Now, most of the country has lived the last 2 years in isolation, but as lockdown restrictions are eased and people become more social, their immune systems are being put to the test. Doctors are now reporting an increase in respiratory viruses. For more on this, I'm joined by Dr. Jeremy Nell, the head of infectious diseases at Wits University. Very good evening to you, Dr. Nell. Thanks for your time. We are seeing the increasing numbers of influenza. Should people now be leaning towards trying to better understand what exactly is wrong with them by opting for a triple swab to find out whether it's COVID-19 or any other sort of respiratory illness?
Yeah, thanks. It's a very good question, and thanks for asking it. Certainly testing for influenza has some role during flu season, which is just getting started at the moment. It's not yet officially been declared, but the cases are rising, and we anticipate that will follow into the technical definition of the flu season starting very shortly. So in that sort of scenario, when people present with this a very similar syndrome, it can be very difficult to tell it apart from COVID. Both diseases have fever and muscle aches and headaches and fatigues and sore throats and things like that. So although there are some differences, for the vast majority of cases, it's very difficult to tell apart. And so testing can help distinguish the two. And that's really of most use for people who have severe disease, who end up in a hospital, for example, in which case the treatment is very different. And it's very important to establish which of the two it is. Much less use for mild disease, because in the influenza's case, there's not a lot that you usually do unless you're at very high risk for severe disease with influenza. So much less need to test for flu for mild disease, although there can be some benefits to individuals, for example, just to know what they have, for example.
What's making it so hard to differentiate? I mean, you make mention of us moving into the more colder winter months, but what are the other factors that make it so difficult to really not know what exactly is going on with you?
Sure. I think the main reason is just that the symptoms overlap so much. It's very difficult. So if someone comes in with a cough and headache and some muscle aches, at this time of year where both flu and COVID are both rising in terms of caseloads, it could be either one of those. There are some differences. For example, COVID causing severe disease is very unlikely in the young children, whereas flu is quite a big cause of severe disease, particularly in infants and in the younger children. Things like loss of taste and smell are much more common with COVID than flu. But in general, these are very difficult to tell apart clinically. So really, we rely on tests to tell them apart, and these swabs are the main way to do that.
As the country sees more cases steadily rising over the last few weeks and the fears of perhaps a new COVID-19 variant being, within the space, what would you advise as the best preventative measures for people to take?
Well, for adults, so we'll leave that third virus that you mentioned earlier, the RSV, alone, because that's really a children's disease. But for adults, between flu and COVID, both of them, the single best way to prevent severe disease is vaccination. And so it's really a good time to make sure that your COVID vaccines are up to date, including boosters if you need them, and including your flu vaccine, because now's a good time. With all of these vaccines, it takes a week or two until protection develops. So it's a good time to get them if you haven't already, and make sure that you're prepared as you can be for the upcoming waves. And that is the majority of the way, and that's the key message to get out there. But we do know the other things, for example, mask wearing, hand hygiene, avoiding crowded indoor spaces, things like that really do work for all respiratory viruses to a greater and lesser degree. In fact, they might be even better at preventing flu than they are with COVID. So the same sort of measures which we've all been very sadly familiar with now after 2 and a bit years of COVID, they work for flu too. And they, again, particularly if you're at high risk of influenza or high risk of COVID in terms of severe disease, those are the sort of measures where you should pay particular heed to try and prevent yourself from getting sick.
And very lastly, before we let you go, what are some of the patterns that you've assessed during this space where, the lockdown regulations have sort of eased and people are, not really as attached to their masks as they were before?
Yeah, so the effects of these on COVID itself are difficult because the variants now are very infectious, even with the measures that we have. Not to say that the measures we have, such as mask wearing, don't help. They do. But it doesn't fundamentally alter the trajectory of the COVID wave. They're actually paradoxically a lot better at preventing things like flu. So much so that in 2020, for example, when we had the lockdown and we had the mask wearing and the social distancing and the hand hygiene, although we had COVID waves, obviously, we had almost no influenza at all in 2020. So these measures we've used for COVID have really knocked out of kilter the traditional kind of patterns for influenza and that other virus, RSV. And they've been quite different. So that's where it's be interesting to see what happens in 2020, but it pays to be prepared, and vaccines being the key measure to make sure that you're protected with.
Very well. Thank you for your time. Let's leave it there for now. The head of infectious diseases at Wits University, Dr. Jeremy Nell. The operative word, vaccinate, as, of course, the cases continue to rise.